Mr. Chair, and thank you to the Minister for being here. So, is there anything in this legislation that will prevent employers from cancelling or downgrading existing insurance plans?
Well, there's nothing that would change that. I was the head of Heart and Stroke, so I negotiated private insurance plans. I can tell you that that for insurance companies, they very much want to continue their businesses. So the fact that underinsured and uninsured people are now going to have the ability to get the medicine they need represents no threat to insurance companies. I think that. Well, but that gets to it. I mean, if you're an employer, as I said, I would negotiate the health benefits for employees. Obviously health benefit employees include much more than just diabetes drugs and contraceptives. So
I'm asking if
to drop your plan because a portion of medicine it's just not logical, right? No company would do that.
All right. So if this is a single payer program, is anyone going to lose coverage from existing plans?
The objective here, no. We're making sure that people have choice, so that allows people to have a choice about where they would go. So, for example, if you had somebody with 70% coverage and they can go to a public plan with 100% coverage, I imagine that they would make that choice. But if they prefer their private plan, they could continue to use their plan. So
you can assure us that no one will lose coverage based on this legislation?
I can assure you, yes.
Thank you. So what consultations did you do specifically with Minister Adriana LaGrange in advance of putting forward this bill?
Yeah, I had conversations with all ministers, including with Adriana, and obviously there's a lot to settle. We just know that we're talking here about diabetes, drugs, and contraceptives, but there's been positive conversations.
She's stated that you did not consult with her before putting forward this bill.
Well, she and I have talked many times.
Did you do it before putting forward this bill on this bill?
Yes, but I mean, I think that I want to be careful because if I could, Mr. Chair, if I could be precise, because I don't want to mischaracterize it. There were, obviously, but before the introduction of the bill, those conversations had to be very high level. So in fairness to her, there were not detailed conversations because, of course, I would have been precluded from having those. But we had conversations before and after generally about it, yes.
What about with Everett Henley from the Minister in Saskatchewan?
It'd be the same thing. I mean, obviously, before a bill exists, I can't share something of that nature. That would be violating and disrespecting Parliament. But at a very high level, for sure, there were conversations with Everett and in Saskatchewan and elsewhere about the general concept, and that I would come back to him with more details.
Minister Henley is saying that you also didn't have specific conversations with him in advance of this bill. So my question becomes, if you didn't have conversations with the two ministers from Alberta and Saskatchewan, and we know Quebec has shared some concerns regarding provincial jurisdiction. We've had Saskatchewan, Alberta, and Quebec all state that they want to opt out of this program. Why did you not just put your ego down and work with the existing provincial government and their existing plans to provide the coverage for those gaps?
Well, that's precisely what we're going to do. I mean, I can't.
That's not what this bill is.
Well,
this is not what this bill does.
Mr. Chair, if I could be afforded the opportunity. There were a lot of people who said we wouldn't get an Aging with Dignity or Working Together agreement with Alberta or Saskatchewan. Of course, we did. And I can say that on this subject, that we've had very productive conversations around the needs in those provinces. I couldn't go into the level of detail of what would be in a bill. That would have violated parliamentary privilege. But afterwards, we've had very constructive.
Do you have a deal with Alberta, Saskatchewan?
We do. We have
Quebec?
Deals there are 26 deals across the country. Yes, we have deals with every single province, every single territory on health care. They were negotiated collaboratively, and I'm very confident we'll get a deal on pharmacare as well.
On pharmacare, do you have deals with the provinces on pharmacare?
Well, that would violate Parliament. Parliament needs to adopt this legislation before I could do that. So I would be violating. I'd be negotiating with no parliamentary authority. I'm not allowed to do that.
Your committee of experts, will it have representatives from provinces and territories?
So I'm open to your feedback. If the committee of experts, I think is exceptionally important that we have people who understand the current context, and that obviously provincial consultations with provinces and territories will be a critical part of their process.
Minister, I'm wanting to bring forward an amendment to ensure that there is a representative that is named by every single province and territory across the country to make sure that their voices are heard when it comes to the Committee of Experts. Will you allow the Liberal NDP members on this committee to support that amendment? Yes or no?
I don't think consultation any more than federal provincial consultation.
So you won't support that amendment?
No, and I'll tell you why. Because I mean that's an extraordinary number of people for an unnecessary outcome. I mean, negotiating with the provinces.
So you don't think negotiating with provinces is a good idea?
I do that every day. I mean, there's not a province or territory that I'm not speaking to on a daily basis, and that will continue. I've been to every province and every territory at least twice with the provinces, and once in the case of the territories, and I'm talking every day with them. So
I think that is exceptionally condescending to provincial provinces that have their own jurisdiction on this.
That's your time.